Hi, I'm Dr. Manoharan, specialist dermatologist working with Aster Clinic, TCOM and JLT. Today I'm going to talk about prevention of skin cancer. Cancer, the word itself evokes fear in the minds of even the bravest. Cancer is actually a condition in which organized cell populations with specific controls on their growth, their multiplication and function become disorganized, they multiply abnormally and they do not function in a normal fashion. Cancer can be broadly understood under three headings. One is cancers of the epithelial tissues, which include the vast majority of the cancers, including skin cancer, cancers of the lung, the breast, the colon, etc. Cancers of the hematopoietic system, which includes blood cancers, and cancers of the mesenchymal tissues, which include soft tissue tumors and muscle tumors. Talking about skin cancer, there are three major types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Sun exposure is the single major risk factor for both basal cell carcinoma and squamous cell carcinoma. While intermittent sun exposure and the risk of getting sunburns in adult life predisposes for getting basal cell carcinoma, it is the cumulative sun exposure and the occurrence of sunburns earlier in childhood which is responsible for getting squamous cell carcinoma. And also, squamous cell carcinoma can occur because of cigarette smoking, exposure to ultraviolet radiations, exposure to ionizing radiations, and human papillomaviruses. When we talk about human papillomaviruses, it's mainly the squamous cell carcinomas of the cervix and the penis, that is the male and female genital tracts. In other places, human papillomaviruses have got no role to cause. For malignant melanoma, again, sun exposure is an important risk factor, though people who are genetically predisposed are more likely to get malignant melanoma, especially people with very fair skin which never tans and always burns, and people who have a lot of moles and freckles on their skin. Prevention of skin cancer rests with awareness of sun exposure as much as possible. Usage of sunscreens will help you prevent squamous cell carcinomas, though not basal cell or the malignant melanomas. So, especially patients who have a fair skin, those who have multiple moles on their bodies, these people should be very careful. They should frequently get followed up with a dermatologist for checking up whether any of these moles have become malignant. Also, if you have a history of cancer in your family, please be careful. Always get yourself screened periodically. Just follow these simple things and you will be leading a happy life without cancer. Thank you.